Good day, everyone. My name is Permejo, a master's graduate student of Batch 13. Today, I am honored to present a vital topic in healthcare, pressure ulcers. In this presentation, we will be able to explore the causes, the stages, the risk factors, prevention and management of pressure ulcers. Understanding this topic is essential in providing quality care, safe and patient-centered care. This teaching is structured using our Bloom's taxonomy to ensure a deeper and more progressive learning experience. The objectives are designed to help you remember the key facts about pressure ulcers, understanding the development about pressure ulcers, apply prevention strategies in clinical settings, analyze the real patient's cases, evaluate current care practice, and lastly, create effective care plans for prevention and management. By using the Bloom's taxonomy as our guide, we aim to build knowledge step by step, from basic recall to critical thinking and application in real life patient-centered care situations. Let us begin by defining what pressure ulcers are and why they are important in clinical practice. Allow me to share my screen or my presentation for today's session. So what is really pressure ulcer? It is known as a pressure source or a bed source. These are injuries to the skin and underlying tissue primarily caused by a prolonged pressure on the skin. Where are the most common pressure ulcer sites? These are actually common in the bony prominence and even as well in the moist parts of our body. These are in the back of the head, the shoulder blades, the elbows, spine, trochanter, ischial tuberosity, ankles, and the heels. Even as well in the ears, the shoulder, the rib cage, the hips, the knees, and the ankles and toes. What are the common causes of pressure ulcers? We have two common pressure ulcers causes, the internal factors and the external factors. Let's focus in the intrinsic factors or the internal factor. Number one, malnutrition. Second, dehydration. Impaired mobility, existing chronic conditions, impaired sensation, decreased loss of consciousness, infection, and even as well advanced age to your elderly individual, patients or individual who are using steroids and existing pressure ulcer. Moving on to our external factor, pressure, friction, moisture, incontinence, and shear. What are the stages of your pressure ulcer? Anatomically, if you would be able to integrate with our integumentary system, stages of pressure ulcer starts in your skin, definitely from the stage one, which is your epidermis. The second layer is in your dermis. The third layer, which is your subcutaneous fats, affecting your soft tissue and your bone, which is your third and fourth stages of your pressure ulcer. Specifically, stage one pressure ulcer are your non-blanchable erythema of the intact skin. In stage one pressure ulcer, injuries of the skins are still intact with localized area redness, which does not turn white when pressure is applied. These are known as your non-blanchable erythema. In stage one pressure ulcer, it does not include purple or maroon discoloration, since this may indicate a deep tissue pressure injury. On the other hand, stage two pressure ulcer, it is actually an injury wherein there is an exposed partial thickness loss of your skin with your dermis. The wound bed is pink, red, or even moist. It may also present an intact or ruptured serum-filled blister. Fat and even as well deeper tissue are not yet visible. Your eschar and your epibole may also not be present. In stage two pressure ulcers, these are a common result of an adverse microclimate and shear in your skin. Moving on to your stage 3 pressure ulcer. It involves the full thickness loss of the skin, where fat tissue is visible and granulation tissue, ruled wound edges or the epibole and the eschar may present. However, fascia, muscle tissue, tendon, and ligament and cartilage are even as well not yet exposed. The depth of tissue damage may vary anatomical location, or in areas with significant amounts of fat or risk for developing deeper wounds. In stage 4 pressure ulcer, these are now the skin is in full thickness damage, the tissue loss has even occurred, and even as well the exposed fascia, muscle tendon, ligament, cartilage, or even in the bone in the ulcer. Epibole and eschar may also be present. And lastly, undermining and tunneling can often occur. We have the deep tissue pressure injury. A deep tissue pressure injury presents our localized area, persistent deep red, maroon, or even purple discoloration that does not turn white when pressure is applied, or a separation of revealing dark wound bed or blood-filled blister. Pain and temperature can change, will often precede skin and color changes. Discoloration may also appear in different darkly fermented or pigmented skin. How do we prevent pressure ulcers? There are 6 ways on how to prevent pressure ulcer. First is turn your patient every 2 hours. By using the different patient bed position, alternating the positions from right, back, or even left every 2 hours. We may also put pillows under one hip at a time if patient cannot be able to tolerate in full turning. Second way on how to prevent pressure ulcer is to maximize the remobilization. By applying a passive range of motion, by the help of our physical therapist, we can be able to plan and appropriate measures to patients' direct care when it comes to maximize the remobilization. Third, protect the heels. We can support the entire leg with pillows to allow the heels to suspend above the mattress or even using the heel protectors. We would be able to assess as well the heels and every day for signs of pressure, considering as well pressure may relieve or a distribution in the bed surface. Fourth one is to manage the moisture. The correct cause, even as well for patients who have an existing diarrhea, we can be able to reduce or eliminate the incontinent episodes by even as well doing a perineal care, eventually by using mild soap, rinsing, and even drying the skin well and apply moisture barrier cream. And definitely, if patients have incontinent and it was not even as well having a bladder training, we would not be able to as well not applying diapers while the patients are in bed. The fifth one is to manage the nutrition. Introducing as well a food that are rich in protein, since patients might have an existing wound or pressure ulcer wherein the responsibility of your protein is for muscle regrowing. We need also to consult our dietitian to determine if it's needed for them for any kind of patients who are on tube feedings. Lastly, reducing the shear and friction. By using the appropriate assistive device like your trapeze or the pull sheet for lifting and moving the patient up in bed. We may also apply transparent film or hydrocolloid dressing over the friction areas, especially for your patients who have an existing pressure ulcers. And of course, as well, with pressure ulcer existing patients, we would be able to as well apply the other prevention as well and make sure as well patients are able to manage. As a healthcare professional, it is our responsibility to recognize the importance and preventing and identifying and managing the pressure ulcers to protect our patients and improve their quality of care. Remember, the early intervention through thorough assessment and patient-centered care are key to reducing complications and promoting healthy living. I hope these sessions has deepened your understanding of pressure ulcers and equipped with practical knowledge and you can apply in your clinical practice. Let us continue striving for excellence in the patient care, always guided by compassion, critical thinking, and commitment to safety. Thank you once again, and I look forward you on how to apply this principle in your future roles. Thank you so much and enjoy the rest of your day.